Welcome to the recording of the webinar, Beyond the Prescription Pad, Transforming Lives Through Movement Medicine. The webinar is hosted by Dr. Fraser Quin. The presenters are Associate Professor Dr. Özden Gökdemir and Dr. Hussain Al-Zubaidi with welcome messages from Professor Dr. Shlomo Vinker. This webinar was recorded on the 23rd of November 2023.
Good evening, everybody, and welcome to all the participants that joined us this evening in this joint webinar. And my name is Professor Shlomo Vinker. I'm a family physician and a full professor at the Tel Aviv University in Israel. I'm honored to open this webinar that is the joint activity of our special interest group on lifestyle medicine and the European Lifestyle Medicine Council. Lifestyle changes is a powerful tool that is underused in family medicine. The task of our special interest group is to increase awareness and to implement tools and skills that will help us as family physicians to give better and holistic and comprehensive treatment to our patients. On behalf of Wonka Europe, I wish you all a fruitful and enriching evening. Thank you.
Thank you, Shlomo. My name's Fraser Quin. I'm the Executive Director of the British Society of Lifestyle Medicine and the European Lifestyle Medicine Council. So I'm delighted to be your host this evening. Could I ask you, please, to put all of your questions in the Q&A function, and we'll keep all questions to the end, and I'll pull out some of the more interesting questions, although I'm sure they'll all be very, very interesting. But feel free to say hello on the chat function. I'm not going to waste any more time, but I'm going to introduce Professor Özden Gökdemir, and I hope I've pronounced that correctly. She graduated from the Faculty of Medicine of Karadeniz Technical University in Turkey in 2002. She's currently a member of the Rural Wonka Working Party, a council member, and Eurepa's Executive Committee. She's also Medical Director of, and let me get this right, Eeli Hekmiligli Academizi, and again, I apologize if I've butchered that, but there you go. And a member of the Family Physicians Association Federation Vaccination Control. She's a member of the Turkish Medical Association, Turkish Association of Family Practitioners, and the European General Practice Research Network. She's also a member of the editorial board for the Turkish Journal of Family Medicine Primary Care, Journal of Turkish Family Physicians, and Journal of Applied Science and Clinical Practice. She's also a guest associate editor of Frontiers, if that wasn't enough. So without further ado, Özden, please introduce your talk and take control of the screen.
Oh, thank you very much. And thank you very much for this introduction. It was very, very pleased to me to just be with you. I am very proud to be with you and given opportunity to talk about lifestyle medicine. I do hope that you can see the slides. I think you do, so I am going. Well, we just want to talk about the recipes, but I just want to talk about our children. Why I didn't take the topic under 5, because it is also need much more evidence and much more structure to talk about. These are the ones that we are just together. I'm working in Izmir University of Economics, and why did I took that logo here? Because lifestyle medicine is a curriculum on our undergraduate students in Faculty of Medicine and also in the other fields. And so I just want to mention it. Thank you very much for Lifestyle Medicine Group of Wonka. By this way, we can just talk about it. And yes, I'm a part of the truth is I am the chair of Wonka Working Party of Planetary Health, as you may see, our flying bird. Now, I just want to begin with our members, Suzanne and Mariana. Mariana is, we are calling Marin, are the ones member of Wonka Working Party on lifestyle medicine, and they have just made an abstract about obesity and also screen time. It was about adults and why, as we do know about adults, what about the thing with screen time and the children? We are talking about physical activity. Can we just do it with the screen time, or should be done with another way? Like what? For example, in chronic diseases in adulthood, we are just saying that physical activity will just improve their quality of life. What about childhood and adolescence? Overnutrition, metabolic syndrome, and the other genetic predispositions maybe will just come to us or will be a reason for the other inflammations, like what? Like insulin resistance or atherosclerosis. This is the thing that we just seen in Karolinska University that we were talking about another workshop with our group. We find out that they have been talking about the health and screen time. It is interesting that Karolinska University has just printed out that children online at least 3 hours a day. That means they are just sitting still, doing nothing, and looking at all day long for their screen. But it was interesting that while the children are playing games, and mostly the boys are playing games, in mental health they are much more, seems to be healthy, vice versa, for we can just take it for the girls. If we just look at a little bit more deeply, will it change anything? Yes, because when we are just screening out, we are putting lots of loads on our spine too, and it will just bring us another morphologic disorders because of the screen time. So how can we just do the physical activity for our children and adolescents? Could we use these screen time activities with them, or is there a way of it? Can we just think to just making and measuring what about the physical activity could do of them, or could be just a way of their daily life? So let's look at it again. When you are sitting still on the screen, while I'm telling screen, it is not only the phone, it could be the television, it could be the online lessons and so on. So it will be just affecting the metabolic syndrome in adolescence. So there will be complications of obesity. As you may see, the physiology just goes through the, not physiology, but pathology. In metabolic syndrome, as you may see, there are lots of units that we could just talk about. All the family physicians, my colleagues are now listening and they do know what are the parameters of it. So another, the last recent review that I want to share with you, we did understand that if the obesity grows up, it just not only make lots of weight on it, but also it weights lots of inflammation on it. So it could be just go to carcinogenesis and depression and lots of other diseases that we should just have to look on or manage. So why we are talking about body mass indexes and the other problems, we just learned there are cancers and the other problems, and it just goes with the inflammation. In here, it also says that it is the latest research from the one that I have been just looking through. We can just make a little more physical activity that will affect the all-cause mortality and morbidity of the new generation. How can we? First of all, let's think that it is fun. If we are just making something a fun of it, so we just keep it on going. If it is a work, maybe we wouldn't, but if it is fun, why don't we? So for the children and adolescents, we can just talking about the physical activity, a moderate, vigorous physical activity daily for fun. In here, I just want to look at it for the planetary health part too. You may see one is lung and the other is the branches of tree. For the aerobic exercise, we will need oxygen, not an air pollution. So for this part, for the good conditions, we can say that not only physical activity, but in the clean air, physical activity will affect more and more precisely. Muscle strengthening is another part of it. Why I'm talking that, as you may remember, elderly care is very important, and in here we are just talking about virility. But in children and adolescents, if they are not making their physical activity appropriately, so the virility age will just go lower, and also the osteoporosis age will go lower too. That means we wouldn't see the patients at 65-year-old or over. More and more younger ones will be the target position. So muscle strengthening is another way that we could use it. Like what? Climbing trees. If you could just find the tree, yes, of course we can just climb the trees. If not, what can we do? Just lifting weights could be another way of it, or using resistance bands. Bone strength is also a way of it, as I told for the last slide, because by this way we can just use the physical activities at least 3 days a week. How much physical activity will be needed if we don't want to be obese? In here, we are just talking about another unit. It is metabolic equivalent of task. Most of the sport physiologists are using this one. It is approximately 1 or 3% of body weight that we can use, and we can just make it per week for losing weight. In here, why we are losing weight? We are just want to lose the fat, not the bone and not the muscles, of course. In here, you may see that when we are gaining loss of fat, although the capacity seems safe, the bones and the muscles are just going lesser and lesser. So we can just, let's make a comparison for less active and active ones. Will it change anything for body mass index? As you may see, yes, of course it changed. For the physical activity and body mass parameters, we can just make it per week, of course, to just make it much more in dimension, and also to look at it in total and abdominal weight, we can just lose it. So let's lose fat in here. For the evidence, we can just say that for the young people, age between let me say 3 and 20, these are the people that we are talking here. The physical activity levels are so low, and it is getting lower and lower. That means sedentary time is increasing and increasing. How can we make for being active? While we are talking about children to do physical active, so what are we doing then? So if we could be physical active, they could be too. So reducing antisocial behavior, just more cooperation and teamwork and self-esteem are the beneficiary of physical activity. Also lower risk of diseases. In here it says that moderate to vigorous. For the elderly, we are just saying just begin little by little. You don't need to just make a race with yourself. But for children, we can just begin with moderate exercise. The first part is to begin. If we just thinking about to begin, in a way, not stopping, we can just find a way to go move forward. In this vigorous exercise, how can we say that it will be just effective or not? Football, basketball, or dancing kit with our children to do, you should just go to football, or you just say make a bike riding. In here, the fun part shouldn't be just away from them. So push-ups and lifting weights could be another way for them too. Light physical activity is, for example, walking to school. In here, we can say that community-oriented primary care is needed. Like what? If there's a way to walk to your school, you can walk. If there's a way that you can just go park with your friends, you can go. If there isn't anything like that, how can you do that? So community-oriented primary care tools are needed to go forward for this. Recreational screen time may be a way to use it. How can we? Yes, our children are just playing games with each other in their rooms with the other ones, okay, but couldn't be just like the physical activity play games. This is important and thank you very much for the organizers and Shlomo also and Wonka, because November 20th is the annual celebrated day for World Children's Day, and children is important. They are our hope. I do hope that we can just bring beautiful children to this world to make it much more beautiful or much more enlightened. And let me say for the song, those were the days, my friend, we were never end. Yes, these were the parts, but I was much more younger. And the physical activity part is from this academicians, and I just want to thank them. We can create a worksite environment that promotes physical activity. By this way, not only the children, but all the community could just be in physical active way. For the air pollution, we can use these courses. It is just made with WHO. And don't forget that European Lifestyle Medicine Organization has also defined that air pollution is a way and also a need that had to be defined in lifestyle medicine. And so another way to just look at this, the courses, let's don't forget that if we need free tools to learn more deeply about lifestyle medicine, we have got NextGenu and can use it whenever we want. 1 minute for our planet and lots of minutes for physical activity. To live like a tree alone and free in a brotherhood like the forest. This evening is ours, a poem of Nazım Hikmet. Thank you very much. And if you would like to ask anything, I think we will just do it later. I'm just trying to stop my sharing. And thank you very much for listening.
Fantastic. Thank you. There's nothing we like better than a speaker that sticks to the time. It's fantastic. Thank you very much. That was really interesting. Let me move straight over then to Hussain Al-Zubaidi. Sorry again about that. Hussain is one of the hardest working members of BSLM and very well known to our membership, but he may well be known to a lot of you, so it'll be great for you to hear his presentation. Hussain says that movement, community, and nutrition are three cornerstones of his professional and personal life. He's a lifestyle medic, TV doctor, and long-distance triathlete, international triathlete, I should probably add. I have a varied portfolio career across different sectors, he says, and he is also RCGP, that's a Royal College of General Practitioners, lifestyle and physical activity lead, as well as Swim England clinical advisor. He runs a pioneering NHS-based fitness club and lifestyle clinic and heads up the personalised care team at the Leamington Primary Care Network, made up of dietitians, social prescribers, and health and wellbeing coaches. So without further ado, Hussain, please introduce your presentation and take the screen.
Thank you so much, and thank you for that initial talk. It was really informative, really enjoyed it. Hi guys, so yeah, my name's Hussain, really passionate when it comes to physical activity as one of the really most important pillars, in my opinion, alongside community. And I think hopefully what we'll discuss today is I'll explain how, you know, physical activity can be a way that we can achieve some of the other pillars within lifestyle medicine, which is just as important. So we've already kind of gone through a bit about myself, so I'm going to skip through that because Fraser's very kindly and thoroughly gone through my history. So what I want to talk about today is how do we go about encouraging people in our community, our patients, that need physical activity the most. We've all seen the graph where the initial 30 minutes of activity, of movement, has the majority of the health benefits. And I think what's really important is that we help to translate that across to our patients, because when I speak to most people, I don't think they quite realize that they can get so much from often so little movement. Many think that they need to be super fit, super active, you know, like they see on Instagram or on TV to really gain the benefits, and that can put them off. So I think that first E on that slide, engagement, it's really important to find the way and use the language that the patient uses around movement. So as the very start of what I do when let's say I'm in a consultation with a patient is I really just find out the story, like what does movement mean to them? You know, like what interests do they have around sport or physical activity? And then I'll reflect that back in how I want to engage them. Because, like, for example, I love triathlon, but I know full well that that's not going to connect with lots of people. So it's foolish of me to just try and promote just specific ways of moving because I'm interested in them or I'm knowledgeable in them. It's more important to engage the patient to take you on that journey, if that makes sense. And then the second E that I think is really important when it comes to embedding physical activity in primary care is education. And that's not often what people think of. It's not me educating the patient. It's them educating either myself or the other staff members within the primary care setting. Because if we are going to encourage them to take up physical activity, we need to understand their insights, their barriers, their enjoyment, so that therefore we can have a more bespoke and connective experience. I think too often, like clinicians from good meaning have given generic advice of, you know, sort of eat less, move more, and that can not always be effective in my opinion. And I think we can do better than that. And there's lots of resources now. I know in the UK there's moving medicine, but you know, I'm sure in many countries there's ways that we can use reframing of our language to help engage. And then the final bit is that evolution. Like many people want to get to a certain end destination. Maybe they want to complete 5 kilometers for the first time, or they want to be able to do a bike ride that they've always wanted, or a certain hike. But it's that journey from A to B that can be really challenging. And it leads to that boom bust where they go about that journey, but after a few weeks, they haven't managed it. It's much more difficult than they thought it was. Maybe they're less fit than they thought, or they're struggling with long-term health conditions and the implication of that. We need to really encourage our patients to understand that this is an evolution. It's not about achieving a certain thing, but it's about a mindset and a process by which they're going to look to make choices in their life where they can get a bit more active. Now, some of the key reasons that I think physical activity can be really powerful is because when it's done right, it's fun. It's a connected experience, and it can be something that can galvanize the community. And when I say community, that's not just our patient community, but our practice staff. This is a picture of many of the staff members at my own practice in Leamington, which is sort of in the Midlands in the UK. And the journey that we've gone on to try to encourage physical activity has been one not just for our patients, but very much for ourselves. And it's been great to see so many staff members take up more movement and the benefits that they've gained from it. Now, one method that we use within UK primary care is the Park Run Practice Initiative. And I'd love to hear anyone, if you pop in the chat, if maybe your practice, maybe you're based in the UK and you're a Park Run practice. But Park Run is something that's in a number of countries, in fact, over 20 countries. So there are a number of European nations that may be able to connect with their local Park Run. And I just want to show you a short video of how primary care can connect with a free initiative like Park Run, which runs 5-kilometer walks and runs at local parks up and down the country. And it combines those ingredients of movement and community.
Keep it going, well done.
The Parkrun Practice Initiative is a way for GP surgeries up and down the country to connect with the local parkrun event. Parkrun has been a massive public health initiative. I've seen the benefits of connecting patients and colleagues to parkrun, and it's important that we share that amongst the profession.
So I got diagnosed with breast cancer in June 2018, and I had to have surgery, and I had to have chemotherapy, and I had to have radiotherapy. And all the way through my treatment, I think I was at parkrun every week. For my physical and mental health, it was really important to me to keep moving. And of course, every week I came, all my friends at parkrun would be cheering me over the finish line and cheering me all the way around. And somebody once said to me, well, parkrun isn't really about the running, it's about the community, and it's about the people. And then they just happen to go for a run while they're there.
Go, Peter!
Woo!
I've been going into my GP for a number of years with bouts of depression, anxiety, and occasionally I'd go on some medication, and then when I felt better I'd come off it, and it was just getting to be a cycle really. And then the most recent time I'd gone in, my GP suggested, should we try something different? And he said about parkrun, and he said, you know, you can just walk. There's a lot of us down there, I'll be there. So I came along and did my first parkrun, and all the volunteers were brilliant, big cheer at the end. And I felt fantastic and didn't go on antidepressants and haven't been on any since.
It genuinely has made so much difference. Since doing parkrun, I've done 10Ks, half marathons, I've done a couple of marathons, but also I think it's massively increased my confidence to have a go at other sports. You know, even though I can't see, I feel just part of the whole thing. It doesn't make any difference. Everyone's so supportive, they cheer you on, they encourage you. It's just a brilliant atmosphere, I love it.
So I'm Abby, I'm a GP in York, and I set up our practice as a parkrun practice when it was first launched. We have lots of different ways of advertising parkrun, you know, on our boards, on our TVs, on our website, social media, but the strongest message is to a patient sat in front of me and telling them why parkrun is brilliant.
The Parkrun Practice Initiative is a call to arms for primary care across the United Kingdom to connect with the local parkrun events. I've seen firsthand the benefits that it can have, not just for the patients that are signposted to the events, but also the practice teams that get involved with the initiative. It's a way for the community and the practice to connect and get together, but also a way that we can all enhance our well-being. This is not just for patients. I would very much welcome practices across the UK to sign up to the Parkrun Practice Initiative as a way to boost staff morale and well-being, to connect with your community, and to support the patients that we serve. And if, for example, you don't have parkrun in your nation, then there is nearly always a community physical activity group out there that I would highly recommend you forge some relationships with. You know, get to know it, visit it yourself, have a go, and then use that as a platform to help encourage patients, because it's always easier when there's others there, when you have that environment, that safe place that people can get active. It's not a competition, it's not a race, it's just moving, enjoying nature and being around others. Now, the Royal College of GPs has an initiative called the Active Practice, and this is really a way that we can support physical activity being embedded in primary care. And in fact, it's open to those surgeries that are outside the UK. Of course, the majority are based there because that's where the Royal College is, but we're open to applications from across Europe. And this is essentially achieving a status if you complete 5 key criteria. They're listed here on the slide, and they're around sedentary behavior, physical activity, and partnering with a local provider. And of course, the example that I just showed you, one is parkrun, but it can be any local provider. And as you can see there, it's not just patients, it's staff as well. We know that if we are going to encourage more patients to get active, then the best advocates are staff that implement it in their own lifestyles. And so, I think it's really important that we don't just focus on patients. Those of us that are passionate about lifestyle medicine, part of the role, in my opinion, is about inspiring those colleagues around us that maybe not share that same passion specifically, but they still must care about their own well-being. And it's not about telling them what to do, but leading by example and offering support when it's asked. Now, what I want to signpost you to is the physical activity hub that's on the Royal College of GP's website. If you simply just Google RCGP and physical activity, it will take you there. It's a website with lots of resources, lots of information, tips and tricks to help you get your practice and your own professional work to utilize more physical activity. And as well, it's got lots of contact details if you want further support from us. We'd be happy to, regardless of whether you're based in the UK or not. Now, when I sort of talk about my own practice in Leamington, we've been on a fair journey about how we get people embedding new lifestyles and in particular physical activity. And I just want to show you some of the sessions that we run. Now, Fraser mentioned at the beginning that we have a group lifestyle clinic as well as one-to-one lifestyle appointments. And these are all around embedding and supporting patients to make behavior changes towards a healthier life. And the first session of our group clinics is called Happy and Healthy Me. This is where we find out about them. They educate us about the health beliefs, about the aspirations, the challenges and barriers. And then in session 2, we look about behavior. We explore what communities they've built around. We discuss the COMB model. So this is the capacity, opportunity, motivation, behavior change model. We teach them some of the reasons why we live in the environment that we do. Because, I think it's fair to say that the vast majority of European nations, maybe less so Southern Europe, we have a, osteosarcopenic obesity epidemic. This is where, as was very well laid out in the initial presentation, our environment is designed, unfortunately, to make us unwell. It engineers movement out of our lives, whether it be cars, robot mowers and hoovers, electric whisks, a lift. Wherever we can take movement out, we've done that. And so when we look at the blue zones, the places on Earth where we have the highest concentration of centenarians, they aren't, gym heads. They aren't triathletes like myself. They just have movement built into their everyday, whether it's washing their clothes or gathering their food or climbing up some of the ridiculous hills that they have in Sardinia. Like, I don't think anyone cycles up them. They seem way too steep for that. But we try to explain that, look, it isn't that you are weak or that you are greedy or that, you're a bad person, because to be honest, many of them think that. And instead, we try to let them know that, look, there's a reason why we have such high rates of obesity and lifestyle-related conditions in the UK and other developed nations. They're not alone in that. So we just try to work on how can we control the environment in each of their lives to get that benefit. The third session is around nutrition. And this is where we just have to have that approach of focusing on what do we want to add into our diet rather than to remove. Because many of them come from an angle of dieting and focusing on, I can't eat this, I can't have that. And we look to have a more sustainable one. We focus on the Mediterranean diet and looking for diversity to maximize gut health. And we try to encourage them to enjoy food rather than fear it. Now, I have a question that I want to put out, and hopefully you guys can pop it in the chat. Which land animal can run the longest, or walk actually, can continually travel or continually move, let's use the right term. So which land animal can continually move the longest without stopping? Okay, I'm going to give you some two options potentially, just as an examples. We've got an antelope. That's probably the most common answer that I get. We've also got a cheetah. What do people think? Pop it in the chat. Let me know which animal can go the longest. Oh yeah, we've got a few answers coming in. Anyone else? And you can see that we are in. I'm teaching to the converted, because normally I get all sorts of answers, but clearly everyone knows what they're doing. Oh yes, don't forget women. Humankind, I think, is what they're saying. Absolutely, it's humans. You know, we are incredible long distance endurance athletes. I always think there's this hilarious story of the Travis Cup, which is a horse race that happens in the Western States in America. It's 100 miles. And a chap called Gordy would do it each year, and it was really important to him. And one year, his horse went lame, literally hours before the start. But he'd already paid the entrance fee, and, well, he loved the scenery. It's up some incredible mountains in the Western States. So he decided that, do you know what, I'm just going to walk and run it. I'm going to enjoy it. And all the horses went off, and they all took a huge lead. And he was like, well, this is probably going to take some time, but I'll give them my best and I'll push myself. And he was a keen runner, but he had never done anything longer than a marathon before. So 100 miles was quite something. And, well, he got to the finish line, and everyone asked him, like, what's going on? Where's your horse? And he goes, oh, no, it went lame. I just decided just to run and walk it. I'm assuming everyone's gone. And in fact, he'd come first. He had won. He did it in just under 24 hours. And while the horses could, do a faster speed, they couldn't maintain it for as long as he could without rest. So, yeah, what I'm trying to get at here is that humans are designed to be incredible endurance animals. If we do not lead a life full of movement, things go wrong. Okay, our bodies are designed to do that and to maximize that. Now, talking about movement, I want us all to move for the next 30 seconds. So I'm not hypocrites, because we're all sitting down, at least I am. So I just want 30 seconds of just gentle squats. There's no need to race because we can't see you, but I'm going to trust that you're doing it with me, and I'm not the only one looking like a worry. But yeah, just 10 seconds left. And just little breaks like this is so important, because one study by Richard Main, who's a doctor in Ireland, showed that just moving that little bit every 45 minutes can reduce the impact that sedentary activity has on our lives. Because I think that's very different. We can be an active couch potato. So that's where maybe you're doing that 5-kilometer run in the evening. But if you spend the day sat down on your chair for 8, 9, 10 hours, then there are going to be health impacts from that, which isn't negated by just that half an hour of activity later on. And that brings us on to the most important thing, the physical activity. So one thing that I was really desperate to do was to actually get patients moving. I didn't want to just talk about it, discuss it. I wanted to move with them. And that's where I started this sort of journey of forging relationships with organizations that could help us achieve those aims. And one of the first relationships that I established was with the international charity, actually, of Run Talk Run and Walk Talk Walk. So they help set up walks and runs which are focused on mental health and community, hence the talk bit that's sandwiched in the middle there. And they provide all the training, they provide all the costs, including the insurance and liability. So that was fantastic from my perspective, because I didn't really know what I was doing in that area, and I needed training, I needed help with the costs, because in the early days, trying to get sign up from the practice that I worked at was always challenging, because this was always viewed as an extra. It wasn't seen as something that was core in the family medicine work that we were doing. So we started off by setting up a few walks, and then we did some jogs, and the patients really liked it and they enjoyed it. But for some, because of some of the long-term conditions they had or preference, walking or jogging just wasn't for them. And that's where I was really grateful to get the support of Swim England and Mental Health Swims. And we have free swimming each week where patients can get into the water, guided by either myself or one of my team, made up of social prescribers, coaches, dietitians. And we will go together with staff that also are interested and want to come down and just access the pool for free and just get that movement. And what's really interesting is that 2/3 of the group don't even know how to swim, but you can do so much more in a pool than swim to get active. And so we do lots of sort of dancing in the pool, just some aerobics. We have some exercises that we just go through with them, and even just walking around and just having fun. Like, I think it's about just making it as easy as possible for them to find the movement. And those are some of the activities that we do, but we've got lots of activities that our community have put on for us. So, for example, our local cycling club helps our patients in getting active, and we will directly signpost them to the groups there. We have a salsa class near us, which takes referrals from our network so we can support patients through dancing. We know the multifaceted benefits that dancing and sort of learned groups can have, whether it be cognitive health as well as the physical and mental health benefits. So definitely from a enjoyment of my own work, these groups embedded in my work in family medicine has been really up there in the satisfaction element. And I've gained so many friends out of the patients that do come to these groups each week over the last few years. Now, I just want to show a very short clip from one of the patients that have accessed our swim group, Darren, who's absolutely amazing and a real inspiration to me. My number one tip is go to your local pool, experience what it's like, experience what swimming can do for you, and then you will become an incredible advocate for the patient. When I first met Darren, he was struggling to keep at even a gentle pace. He was getting quite breathless. That was a combination of course, his baseline fitness, but also the fact that he was recently out of hospital, suffering with a respiratory infection with COVID.
At the end of February 21, I ended up in intensive care for 45 days, put me in an induced coma for 15 days, and then following discharge, I had 2 readmissions from various infections. Immediately in post-recovery, I had real problems with my leg function. I also had breathing issues, I was very short of breath, and then to try and address that, I started swimming. Being able to see Darren swim in the flesh, it's not something that most healthcare professionals will ever get the privilege of doing, because as he continued to swim, you could see visibly how different he was. He was fitter, he looked younger, he looked stronger, and also more confident as well. Swimming is good all-round exercise. So if a doctor's telling you to do something, that's got huge value. And I'm sure most medical professionals would say fitness is something people need to do, but you need to be reminded to do it, and you need to keep being reminded to do it. But I think it's important that we have that in the back of our mind when we are signposting patients to access to water. For many, swimming can be a really good gateway activity. Encouraging them and supporting them on that journey can be far more powerful than a number of the other interventions that we do. So yeah, the offering that we do is more than kind of just 4 group sessions. We really try to make it into a community, because in my opinion, if we are going to encourage patients to get active when they haven't done so for many years, then we have to be collaborative in that approach. We have to take them on that journey. They have to see from us that we think physical activity is just as, or if not more important than the prescriptions, the referrals that we do. And if you demonstrate that, you show that, it will help them
understand, and it will help boost their motivation to take action. So I hope you found that really helpful. I think we're going to use the final few sort of 10 minutes or so going through some questions, and I think hopefully Fraser will be managing that.
Certainly will. Thank you. And thank you again for a timely and prompt finish. It's moderator's dream to have speakers like you two. A couple of comments before we start in on the questions. So Ishmael would like to thank you both for your beautiful presentation. So that was lovely from him. And Hussain, a newly qualified GP in Birmingham, is asking if he could come down and have a look at your clinic and what you're doing in Leamington. So that's Saeed Arif, and I'm sure we can put you guys together if that's something that you would consider. Great.
Yeah,
stuff.
no, of course. Yeah, we've had quite a few people come down and shadow and have a go. As long as you bring your trainers or your swimsuit, then you're in.
That's fantastic. Great. Well, Özden has been incredibly efficient and has answered all of the questions online. So I'm going to pose the same questions to Hussain and see if we get a different perspective on any of them. So I'll combine a couple of the questions to start with, Hussain. So how do you promote movement to those with mental health issues? And are there any specific exercises that are beneficial for people with mental health problems?
Really good questions. So regarding promoting it, it's how you market it. So one of the key groups that we wanted to target early on was those with mental health challenges, both the sort of affective disorders as well as serious mental illness in terms of schizophrenia, bipolar. Like the life expectancy impact of, for example, schizophrenia is far greater than type 2 diabetes. I think people don't even realize just how widespread the impacts can be. So that's why we approached Run Talk Run and Walk Talk Walk. We wanted to use a lot of the language that they had learned in engaging patients from that background. And we also worked with our mental health trust. So our one's called Coventry and Warwickshire Partnership Trust. And they helped to educate the consultants, the mental health nurses, so they could give them our leaflet that they could encourage. And what we found was the people that came to our group, it wasn't because they saw one leaflet or one note, it's because they kept seeing the message. When they were in our waiting room, they saw the message on there with a photo, just seeing that we weren't somehow half marathon runners or anything like that. We were just normal people doing a walk or a jog. They got it from their mental health trust. They got it when they spoke to the nurse, and it's just regularly just drip feeding it. We got there. And to be honest, when we first launched the walk group for mental health difficulties, 2 patients turned up. And it didn't really take off for a good 4 or 5 months. We had maybe 4 or 5 get in there. But then eventually word of mouth spreads, the promotion spreads. And now our walking group just specifically has about 30 to 40 people each week. We've had to have multiple leaders. And as time's gone on, we've had to grow it. So don't expect it's going to be overnight success by any stretch, but if you persevere, keep working with the community, you can get there. Now, the second question there was about, is there one particular form of activity which is more beneficial? You know, I don't think I know that for sure. One thing I would say is I always try to target the movement that the patient wants to do best, the bit that they enjoy most, as naturally that's going to be the thing that I think they're going to glean the most benefit from. I do know that, for example, high intensity exercise has been shown to potentially not be that useful for those with anxiety, and that aerobic exercise has got good evidence in terms of helping those with low mood. But apart from that, I wouldn't comment on sort of specifics beyond that.
Okay, thank you. I'll pose this next question to both of you, actually. So it's an interesting one. What kind of aerobic exercises would you recommend for care home residents? And I don't know whether the implication of that is people with dementia or whether it's just elderly, infirm people. So maybe address both of those issues if possible.
Well,
Özden, do you want to go
first
first?
of all, we should just think about our readiness for physical activity. We didn't just talk from the beginning. We thought that everybody is so healthy. There is nothing with cardiovascular system, so we can use 6 pillars and blah, blah. The truth is there are lots of people for deficiencies. Like what? Maybe I can't see. I am elderly. I have got lots of glasses. I am presbyope. Also I can't see, and put on that I have got a femur fracture and I just made an ongoing surgery, and let me say I am 65 because it was premature menopause. What should I do? I am alone. Will somebody help me to do physical activity? And also, last thing, I don't want to run to a place on the training center to give money, just running, going nowhere. I don't like this. Could be a heart patient, but could be. And so the physical activity is needed. The first thing is if I am ready physically for physical activity. Like what in the chat I just write it. Up and go test is one of the little tool that we can use for everyone. If you can just sit down and without using your arms up and go to a little meters, then come back, that means you can at least do the things by yourself. So this is something, this is as the ones who are just walking, talking, and so on, or climbing, it is nothing. But for the ones for bedridden and while recovery from the surgery, it is marvelous because you can do the things like going to toilet and doing just preparing your meal by yourself, making you wash by yourself is essential. And it is just like breathing. If you can breathe, you wouldn't talk about your nose if it is obstructive or not. But if you can't, the wisdom and the miracle just comes around. So here, first of all, are you ready or are you appropriate for physical activity? The other one is just make it little by little. You don't need to be a champion or nobody will just give you a medal for it. The medal is that you are better than the yesterday. The other part is, but for not the young ones, for the elderly, sometimes just to walk together is much more greater because you can share the things in the memories or the gossiping a little bit with the neighbors and so on. And while you're making this, the social activity just brings together because you are not alone anymore.
Thank you. Hussain?
Yeah, so this is something that we've worked on more recently in the last 12 months because we realized it was a group, in particular those in care homes and nursing homes, that our activities just was not touching, so that they were being missed out. And so we did a fair bit of research and we worked alongside a number of partners, and we decided to do sort of focused interventions for different groups. So, for example, for those with Parkinson's, we set up a dance group, which was led by a trained sports therapist in specifically dementia. They'd done a PhD in and around, Parkinson's, and he used the dance group in order to help improve functioning in the specific areas that Parkinson's was impacting, if that makes sense, in balance, in trying to help with smoothness of the motion. And then the other thing that we did within the care homes was we gave each of the nursing homes a DVD to play for chair-based exercises that they would run just before lunchtime. And so everyone would do it in the sort of living room area in a sort of a shared and fun way. And then the best intervention that we did was we worked with a company called Good Boost to do gamification of movement. So they come into the nursing homes, they gave us a set of games that we would play with the residents, and we were playing all sorts of cool stuff and just having fun, and the sort of competitive side of the various members would come out. And to be fair, I knew they were practicing because when I went back a few months later and played the game with them, they all beat me. And mainly because it was unfair, because they'd been practicing consistently for 2 months and I had no chance. And I just loved how it was just a fun way for people to just get out a bit of the youth. They would tell me that, yeah, look, I couldn't do some of the things that I could do before, but they just loved how they could just have fun throwing hoops, catching balls, doing sort of just silly stuff in a fun way that allowed movement.
Fantastic. Great. I think we've got time for one final question, although there is one in there which doesn't need answered really. You'll have heard this thousands of times before, Hussain, so don't bother answering it. And I don't mean to disrespect the questioner at all, but how do you manage to combine your GP consultations with all the other engagement programs that you work in? So you'll have heard that 1,000 times. Full of energy. There is a question here, though, and again, Özden has answered online, so we'll see if Hussain answers this differently. Are there any specific populations that benefit most from movement? And the example that was given was perhaps older people with joint pain. But is there a cohort that you could look at and say they will benefit more from movement?
Really good question. Like it's any group that is doing the least amount of minutes of activity. Simple as that. We've seen the curve. From 0 to 20 minutes, you get the most benefits. So of course, that's going to be the group that our intervention is going to have the most impact. So we're talking about those that have significant barriers, and those barriers will be variable, whether it be cultural barriers, health barriers, deprivation, you know. And I think what was really upsetting was when I sent out a text to all the patients in Leamington, asking them about the sort of the physical activity routines, like what amounts were they doing, what was their insights, perspectives. The areas of deprivation in our town of Leamington, which has got a variability. There's some areas of high affluence. It's quite a rich town. But then there's these focused areas of severe deprivation. It was in those spots that we saw the most inactivity. And that's because at the end of the day, they are more worried about putting food on their plate than doing exercise. And I 100% get that. And so we realized that one of the key bits that we needed to do was remove the barrier of cost. And so all our activities are free. All our sort of signposting to community groups we fund, because in reality, often there's a money pot sitting out there. They just don't know how to get the person that needs it to the group that's running it. But health is just a brilliant place because we know the people they need. I have their number. I can contact them. And if I contact them, they are more likely to listen than getting a leaflet through the post. So I think we have a responsibility to try to encourage that group of inactive people in our society to get to that activity. Because invariably, it's not because they're lazy. And I think it's really important that we remove that from our mind, because often GPs will tell me, oh, they're just lazy, we can't get them active. But if you walked in their shoes, I think most of us would probably be doing a very similar lifestyle.
Absolutely. Great messages there. Well, I'd like to take the opportunity to thank you both for 2 fantastic presentations and thorough answers to the question, both online and verbally. So on behalf of Wonka and DLMC, thank you very much. And thank you to everybody who has joined, commented and posted a question. So until next time, thank you.
Thank you, everyone.
Thank you and good night.